Welcome to this high-yield explainer on the NICE guidelines for routine antenatal care. Whether you're gearing up for exams or just want to nail down your clinical practice, you're in the right spot. We're going to break down the absolute essentials that are the foundation of modern maternity care.
All right, let's dive right in with the single most important deadline, the booking appointment. This has to happen by 10 weeks and 0 days. Now, why is that so critical? Because this is our golden opportunity, our first real chance to get ahead of any potential risks and to get all those vital screening programs up and running.
So how many times will you see your patient? Well, the guideline is super clear on this. For first-time moms, that's our nulla paris women, we're looking at 10 routine appointments. But for women who've had a baby before, our paris women, it's a more streamlined schedule of 7 appointments. And remembering that difference is key.
Okay, here's how we're going to tackle this. We've got 4 main parts. We'll start with that all-important booking visit. Then, we'll get into the key risk assessments. After that, we'll talk about keeping an eye on the baby's well-being, and we'll finish up with what to do in some common late pregnancy situations.
Right, let's jump into our first section, the booking visit. Seriously, think of this as laying the entire foundation for a healthy pregnancy. It's so much more than just a check-in. It's the strategic first step. This one visit is an absolute powerhouse. You're getting baseline height and weight, you're running initial bloods, and you're taking a deep dive into our full medical and social history. But crucially, this is where you kick off all the national screening programs for things like infectious diseases and genetic conditions. It really is the clinical launchpad for the next 9 months.
Okay, so the foundation is set. Now what? The guidelines immediately pivot to being proactive, to managing risks before they become problems. Let's look at the 3 big risk assessments you absolutely have to stay on top of.
This table is basically your cheat sheet. Notice the pattern. For preeclampsia and VTE, you're assessing risk right at the beginning, and then you keep reassessing. For gestational diabetes, you identify the risk factors at booking, and then you schedule that oral glucose tolerance test for later, between 24 and 28 weeks. You know, these timings and actions, they are prime exam material, so definitely lock these in.
And speaking of preeclampsia, the guideline makes a really important point. It's not enough to just identify the risk. We have to be proactive. For any woman who falls into that high-risk category, the key intervention is advising them to take low-dose aspirin. This is a game changer for prevention. Let's talk specific numbers for blood pressure, because this is another high-stakes area. If a woman who is past 20 weeks pregnant comes in with a first-time reading of 140/90 or higher, that's your trigger. She needs a referral to secondary care, and the clock is ticking. She must be seen within 24 hours.
But what if that number is even higher? If you see a reading of 160/110, well, the urgency just went through the roof. This is considered severe, and the guideline is crystal clear. This requires an urgent, same-day referral. No delays, no waiting around. These numbers mean action, now.
All right, let's shift gears. How do we actually monitor how the baby is doing between all these appointments? How do we keep track of their growth and general well-being? So the guideline asks a pretty fundamental question. For a straightforward, single baby pregnancy, what's our main tool for checking on fetal growth after 24 weeks? You might think it's some fancy, high-tech piece of equipment, but you'd be surprised.
Yep, that's it. The #1 recommended tool is a simple tape measure. We use it to get the symphysis fundal height. It's easy to access, costs next to nothing, and honestly, when it's done right, it's a remarkably effective way to screen for any growth issues.
And there's a really clear 3-step process to follow. Step 1, you measure the SFH at every single appointment from 24 weeks onward. Step 2, you plot that number on a customized growth chart. And step 3, if that dot on the chart is way off, too big, or too small, you act. And acting means offering an ultrasound to get a much better look. It's that simple. Measure, plot, act.
Now, besides growth, we've got fetal movements. And the guidelines message here is all about empowering the patient and making sure we respond fast. The most important thing you can tell a pregnant woman is that if she has any concerns about her baby's movements, she should call maternity services. It doesn't matter if it's 3 in the morning. Any report of reduced movement needs a prompt clinical checkup.
Okay, let's head into our final section. We're going to look at 2 very common, high-stakes scenarios that pop up in late pregnancy, both of which need a really clear and structured plan.
First up, breech presentation after 36 weeks. The pathway is super logical. You start by suspecting it during your abdominal palpation. You then confirm it with an ultrasound scan.
And once it's confirmed, you sit down and have a really important conversation about the three main options: trying to turn the baby with an ECV, planning for a vaginal breech birth, or scheduling an elective C-section. It's all about shared decision-making.
And second, unexplained vaginal bleeding anytime after that first trimester. This is always a red flag. The protocol is firm: immediate referral to secondary care. Once she's there, they'll figure out if she needs to be admitted, they'll use an ultrasound to find out where the placenta is, and this is critical. If she's rhesus D negative, she has to be offered anti-D immunoglobulin.
So after all that, what's the big picture? It's this. Mastering these routine guidelines gives you the solid, reliable framework you need for all antenatal care. This is the bedrock. Once you have this down cold, you're perfectly positioned to then manage all the complex cases and unexpected challenges that will inevitably come your way. This is how we ensure the best possible outcomes for everyone.